So depending on your nursing school, they will give you recommended texts to help you pass NCLEX. Our school gave us the Saunders, didn't give us, we paid for it, examination book, which I found to be helpful. And it was times that I would actually use this book towards the end of the semester. I would look at it and use it even when it came down to me studying certain subjects. So say we were in med-surg and we were learning about respiratory, I would be doing things in med-surg, looking at that med-surg book, but then also turning around looking in this book to kind of get an idea of certain things that they wanted us to look at specifically for NCLEX. So the first thing I would say is when you get one of these is, even if you're not even thinking about NCLEX and it's kind of far away, at least look at the very beginning of the book. They're going to break down kind of what they are going to break down, what NCLEX is all about, as far as how many questions you might get, and it breaks down like how many questions from each category you're going to get, a roundabout amount. And it gives you an idea of how the exam day is going to be. It just is, then this book is called Exam Prep is the chapter. It's a very small section and it goes over all these different categories like client needs, health promotion and maintenance, and it explains to you what exactly is health promotion and maintenance, psychological care, physiological care, those type of things. So you want to understand what they're asking you. That's why I say look at it in the beginning of nursing school, or right when you get done with nursing school. Look at that beginning of that prep area before you get into studying for NCLEX, because you have to understand what are they looking for. You can have all the information top of your class, you got it girl, you about to be somebody nurse, but if you don't understand what they're asking you specifically, you're not gonna pass. You have to really understand what specifically are they looking for in this question. What type of question is this that they want me to answer? So that's why they say in nursing, it's confusing, it's crazy, it's scary, because there could be 3 right answers, but they want you to get that specific answer that fits what exactly they're asking you. So let me just look up a random question. Ooh, hopefully I get it right while I'm talking to y'all. Let's see. Peds. I wasn't really interested in peds. I guess because I don't have kids. But I guess I should get interested now since I got one on the way. The nurse is applying a topical corticosteroid to a client with eczema. The nurse would monitor for the potential for increased systemic, the whole body, absorption of the medication if the medication were being applied to which of the following body areas. So, okay, eczema, corticosteroid. So what they're asking you is what part of the body is going to affect the rest of the body if I put this medication on this patient, has the potential to affect the rest of the body. So it's a few things that come into mind. So before you even look at the answer choices, think in your head, okay, what specifically are they asking me? And then think about, okay, what part of the body would be a weird spot that would affect the whole body? Try to think about the answer before you look at the answer choices, because when you do that, that pretty much is your first mind. You know, people say, do not change your question, don't change your answer, da, 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 da. That's your first mind. So look at that question, reread it if you need to, look at keywords, and think in your mind, okay, I think it's going to be this part of the body. And then when you go through the answer choices, if your answer that you had in your mind is on there, great. If you don't see it, okay, then you can go back to the question and be like, okay, what am I missing? Or you can be like, okay, well, this is close to that. Or you can look at the answers and kind of see why they are the answer choices. So let me go a little bit further. So here are the answer choices: the back, axilla, soles of the feet, palms of the hand. Okay, so to me, I would think about what questions seem similar to each other. So the palms of your hands and the sole of your feet is pretty much similar to me, as far as it's, you know, it's a, I don't know how to explain it, but it's It's similar, you know, the soles of your feet and the palm of your hands are similar parts of your body. Versus your back, okay, that's a large part of your body, but how would that affect the rest of your body? Then I think about the axilla or the armpit. Okay, your armpit has a lot of like lymph nodes in there, like vessels and lymph nodes in that area. It perspires a lot. It's close to your heart. You know, kind of think about that. I would say the armpit for some reason, because it seems like you will absorb more through your armpit than you would anywhere else. The palms of your hand, yeah, they get sweaty, but they don't really absorb a lot of a cream if I were to put it on. Your back, I guess can't see your back being something that would be systemic absorption. So I would think just your armpits, because like I said, it's just an area where it's a lot of lymph nodes right there. So yeah, that's why I don't know. I don't even know if it's right, but let's go look back and see. See, I had no idea about that question, so we're gonna see. So the answer was 2. What was 2? Okay, armpit. Topical corticosteroids can be absorbed into the systemic circulation. Absorption is higher from regions where the skin is easily permeable. So your scalp, your axilla, face, eyelids, neck, perineum, and genitalia, which makes sense. Let's see. And lower form regions, which are okay, so areas of your body that aren't as permeable, meaning that you can't cross through the skin and the cells and all that good stuff to get to your vessels, would be your palms of your hands and the soles of your feet. So okay, so that says, then they have like a test taking strategy. So use the process of elimination. Focus on the subject of the question, areas of high permeability and the potential for increased systemic absorption. Eliminate options 3 and 4 because, so 3 and 4 was the palms of your hand and the soles of your feet. Okay. Because these areas are comparable or alike. See, that's what I was thinking. That the palms of your hand and the soles of your feet they're alike. So why would they give me a question that could, when it's 2 questions that are very similar, it's not either one of those questions unless it's a select all that apply. Because I mean, you can't answer both of them. It has to be one thing. So if there's 2 that are alike, throw those out the bunch. Don't even think about that. So that's exactly what they said. Okay. Let's see. From the remaining options, think about permeability of the skin. So I didn't really think, I guess I thought about permeability. I just thought about like the lymphs. I guess I was wrong when it came to like the lymph nodes. I just feel like your armpits, like it just seems like your pores are more open. Like it just, you know, like things can get in there. That's why I like with the whole thing with cancer. People sound like you get cancer from like wearing deodorant, whatever. I don't know. Anywho, totally different subject. But it just seems like the area of your body just kind of excretes a lot and also absorbs a lot. So that's what they mean by permeability. Think about the permeability of the skin. This should direct you to option 2. So we just broke the whole thing down. And like I said, when you do a question and you look at it, think about your answer. Look at your answer choices, eliminate some stuff right off the bat, and then just kind of at that point it's 50-50. So armpit was totally different than your back. Like I said, your back, to me, corticosteroids are usually applied, you know, to the back. That's where people get, you know, breakouts and stuff like that, and really easily. So anywho, that's that. But then after you do the question, don't just look and say, oh, I got it right, and keep on pushing. Look and see where they're trying to get you to think, like how they're trying to get you to think about the question. So that's very important. It's really, with test taking, it's just all about, it's about your knowledge as well as it's about your thinking capabilities. Like how can you think through this question? Like just outthink the question. Okay. Let's do one more question, one more random question. See, I thought I would do good with integumentary system, because yeah, I have not looked at this stuff in a minute. Okay, let's look at respiratory. Whew. Child. Okay. I'm not like I said, I'm a little rusty, but let's do it. Okay, a client with tuberculosis is started on anti-tuberculosis therapy with isoniazid. INH. Before giving the client the first dose, a nurse ensures that which of the following baseline studies has been completed. Okay. Okay, baseline. So, I mean, we would do some blood work, I'm assuming, but what specifically are we looking for with TB? I can't really think of anything. I can't think of nothing specifically that you would look for with TB. I mean, respiratory, but anywho, let's see. See, this question, I would think they're trying to see if you want a baseline for something, whatever that baseline is, any therapy that you put with that, you're trying to see, is it going to affect your baseline? So I can't think of what INH affects. Apparently, I'm assuming that this medication affects some part of your body, whether it be the renal function, liver function, something like that. But I can't think of what it would affect. So let's get back into it. Electrolyte levels. So that's like their sodium levels, potassium, blah, blah, blah. I don't think it would affect that. If this was a question, say, about like a diuretic, then yeah. But I don't think it would affect that. Coagulation times. I really don't think that INH affects coagulation time. So I can definitely eliminate that because it's not like it's an anticoagulant. It's not like it's heparin or something like that. So that pretty much leaves liver enzyme levels. So that's your liver function. Or serum creatinine levels. So that's your renal function or your kidneys. Let's see. Liver enzyme levels. A lot of medications affect your liver. With the creatinine, a lot of medications can affect your kidneys too. I'm leaning towards 3 liver enzyme levels. Not sure if it's right, but we're gonna find out. So that's page, okay, 519. So the answer is INH therapy can cause an elevation of hepatic enzymes. So it does it is liver enzyme levels. Let's see. Therefore, liver enzyme levels are monitored when therapy is initiated and during the first 3 months of therapy. See, I didn't know that. But I just know that a lot of meds affect your liver because your liver is basically what's breaking down these medications. So is your kidneys though too. It has to go through your kidneys too to filter your urine. It says okay, so So test taking strategy. Use the process of elimination to answer this question correctly. It is necessary to know that this medication can be toxic to the liver. That's why I said there must be something about this med as far as it's affecting some part of your body. That's why we have to get a baseline. I just didn't know that it affected the liver specifically. So, and it tells you to review the adverse effects of various anti-TB medications if this is an area that is unfamiliar to you. So at this point, I'm studying for my NCLEX. I probably will go ahead and look at TB, look at the certain things as far as if you have TB, what are the precautions for people that live with you, what are the medications that you should take, your therapy, that type of thing, and kind of give myself abreast to the subjects, okay? So I got lucky on that one just because I just know that, you know, most medications affect your liver. So that's why I chose that question, but I got lucky. But had I studied it, then I would know. But this is just practice, you know. So that's my way of looking at NCLEX questions. That's how I felt that I was successful. To me, it's not a huge, yes, it's a big deal. You need to pass NCLEX to be a nurse. You're going to pass NCLEX so you can be a nurse. I mean, that's just what it is. But don't don't go crazy about it. Don't be one of those people that say, I'm just such a horrible test taker. Like, don't do that to yourself. Just, you know the information. You just have to know how to think the questions through, how to approach the questions, and how to approach the test. And don't get discouraged if you're taking it and you notice that you're like on question 120 and you're like, okay, like, what the hell? Did I pass or did I not pass? Like, don't get discouraged. Just like take a deep breath and keep on going. If you need to, the State Board of Nursing, they have practice questions and they have like a little program on their website. You can go through, God, what is it called? Hearst? It's something like, there's so many different programs out there to help you get through it. I didn't want to spend no extra money on nothing, so I just used what they gave us at the school. And like I said, I tried my best throughout the program to do NCLEX questions and to be on top of things. Of course, there was times where I wasn't, but I tried my best to. But just look at it as another test. It's just another test, you know. It's a $200 test that you need to pass, and you're going to pass. But don't look at it as the big bad wolf. Just take it and give yourself enough time to study for it. I have another video that talks about tips for new nurses, and in that video I talk about, like, if you're gonna work as a graduate nurse or as a graduate practical nurse, you need to keep in mind that you're not going to be able to study as much for NCLEX because you're working. But if you're working while you're, because I had to work while I was studying for NCLEX, but anytime I came across a medication that I didn't know about, I looked it up, or I wrote it down and looked it up later. Or if I was given like an IM injection, I'll be like, okay, what size is this needle? Okay, it's such and such inch, 1.5 inch needle. Okay, so what's the different areas that I can put it in her body? What's the name of these different muscles? What is the procedure for doing an IM? Like, I try to think about the process like as if I'm in the NCLEX world, not just I'm at work and I got to get this done world. So even if you do have to work while you're studying for NCLEX, just use that time while you're at work to help you to think about these certain things that you're going, like, to help you to think about like the subject or the type of patient that you're taking care of. You got a patient with CHF. Okay, what's some things I'm going to look at? What's my assessment? Okay, I'm going to check their lungs, check their weight, look at their skin. Look, I'm looking for edema. Okay, if I know they got edema, I need to make sure they don't have any open areas. Okay, if they do have open areas, I need to actually assess these open areas, measure them, blah, 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 blah. Go into this whole thing. Okay, what's their diet? Are they on fluid restrictions? Are they adhering to the fluid restrictions? Like, you have to kind of like break down that process within your mind. And you use that part of you that's actually clinical, as long as also back it up with something that's actual textbook. Okay, NCLEX world is totally different from me going to work getting a check world. Okay, it is. I know that one specific subscriber really wanted me to do this video, and I hope that I was able to help you. I couldn't, like, the thing is just, you gotta do NCLEX questions, you gotta do study questions, you gotta look at the rationale, you gotta think about it before you answer it, and then afterwards look at the rationale and think about what the hell were they, you know, what was their you know, rationale behind this answer. Like, what the hell? Like, you have to just work through it and think about it, and you're gonna succeed. And then when it comes to test day, just get in there and just do what you gotta do. That's that. I mean, you're gonna pass. So I hope it was helpful. If there's anything specifically that you want me to talk about, I will do another video, or I will just respond to. I know it took me a while to do this video, but I did it. So yeah, that's that.